The topic for discussion today is chronic constipation. Now, constipation is one of the most common GI symptoms that many people come with. The most common complaint that patients have is straining for stools. Some people say that they pass hard stools. Some people say that they are unable to have bowel movements daily. They do not pass stools in the morning. Some people feel that their stool volume is less, or they have an incomplete sensation of evacuation of stools. So constipation classically is defined when two of the following 6 symptoms are present for at least for a period of more than 3 months. The first is straining while passing stools for more than 25% of the times when you pass stools, passage of lumpy or hard stools, feeling of incomplete evacuation of stools, feeling of an anorectal obstruction, that is something is obstructing when you're passing stool, using manual maneuvers like your finger for removal of stools when you have the urge to pass stools, and having less than 3 spontaneous bowel movements per week. So it is very important when you diagnose chronic constipation is that you rule out irritable bowel syndrome. Now, what is irritable bowel syndrome? Irritable bowel syndrome is when you have abdominal pain which is associated with passing stools, and this pain is related to defecation. It is also associated with change in the frequency and the form of stools. So when you get diagnosed with constipation, your treating physician or gastroenterologist will either order no tests if he feels that this is all IBS or very mild symptoms, or he may ask for a colonoscopy, for a CT scan or an MRI scan, for a pressure study of the colon or a colonic transit study. Now let us look at the treatment for chronic constipation. Most patients with chronic constipation just require reassurance and psychosocial support. It is very good if you increase the daily activity, if you go for a walk or you do some light exercise, that will really help you with constipation. Also, you need to ensure that you need to consume at least 3 to 4 liters of water a day, especially when you're consuming fiber-rich diet, because that will increase the bulk of the stool. Also, take a 6-inch support below your legs when you are passing stools, such that your hips are flexed and you are in a squatting position. So the Indian toilet is the best way to relieve constipation. Now, there are certain drugs that are used to help patients relieve with constipation, and that includes fiber and osmotic laxatives like lactulose, polyethylene glycol and milk of magnesia. A word about fiber in diet: at least 25 grams of fiber should be consumed in a day, and fiber-rich foods include oat, bran, nuts, barley, beans, lentils, maize, fruits, vegetables and isafgol. So it is very important to seek medical help for constipation, and just maybe a little lifestyle modification can help you relieve your symptoms.